Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better at veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Just go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need.
I've often said that you really don't want to do more than 2 procedures a day when you're starting out in basic surgical extractions. And the reason being, if you have a small perio patient, chances are you don't know what you're getting into until you get in there. And it's usually a couple-hour procedure, could run into 3 very easily. And so looking at that from a scheduling standpoint, you can really only do 2, maybe 3 procedures a day if your transition phase between patients is very quick and your radiographs are very quick. If we're talking about a 2 to 3 hour procedure, we're talking about the veterinarian sitting down and doing that procedure for 2 to 3 hours. So let's qualify that. What I would suggest is that you come up with a pricing structure that is consistent with more than what you would charge hourly for general surgery, because you're doing microsurgery essentially, and you're also doing surgery from a surgical extraction standpoint that most practices do not do. You also have to take into consideration that this is a high-end service. This is not a spay. This is not a neuter. This is not a mass removal that on the skin. This is a high-end service like an orthopedic bone plating would be. That you have to have special training, extensive training in order to get good and get proficient at this. So that same population of your clients that would opt for a bone plating procedure would be that same client that opts for full mouth radiographs and surgical extractions with cleaning, bone contouring, and proper closure. So that you have to take that into consideration and keep that in mind in what we're going to be discussing here. So in order for us to justify those type of procedures that are higher end procedures, we have to charge accordingly. And that could be an hourly fee. It could be a fee per tooth based on mobility. And also take into consideration sometimes that tissue is really compromised, whether it's gingival recession or proliferative or friable, otherwise difficult to debride and close properly. So additional charges for that and time allotted for that in the estimate. All of those things are considerations for pricing, and people have different pricing structures that they go by. The bottom line is your 2 to 3 hour, let's say your 2-hour dentistry procedure where you're doing multiple extractions in a general practice would be as much as you would charge for a complicated 2-hour surgical procedure, because you have all the same adjunct, you have all the preparation. In addition to that, you've got something that you normally wouldn't have in general surgery, and that's the radiographs beforehand. So those are going to take some time. but that's not included in the 2 hours that we've been talking about. So all those expenses that the practice is going through need to be charged adequately so that the practice is profitable for that dentistry service. And the dentistry service is, or should be, the most profitable portion of your practice, just because it is very minimal disposable requirements as far as things that you need to do the procedure. You don't have bone plating, screws and plates and all the expensive equipment that you have with that. All the equipment that you buy when you set up your dentistry service with your radiography and your high-speed delivery systems and your instruments should last a very long time. The disposables are minimal and include burrs, instrument sharpening if you have that farmed out somewhere. A lot of things to think about from that perspective. So the line item bottom line here is we need to charge adequately for our procedures, and we cannot just say this is what we would recommend that you charge for a 2-hour procedure. That's all based on demographics and your individual practice, individual wants, and the practice needs to be profitable. When we're looking at it from the number of procedures that we do per day, you don't necessarily have to limit that number of procedures to the 2 procedures that I've talked about, and maybe 3 procedures that I've talked about in the context of being at the early level of competency in surgical extractions from a personal standpoint. If you're more efficient than that, if you've had more training and are comfortable getting through those procedures, comfortable with your dentistry service and their ability to take radiographs quickly and the ability to keep the patients light under anesthesia with your nerve blocks and minimize the transition between patients, then you can do multiple procedures per day. And that's where it gets to the point where it becomes very profitable and justifiable for every practice that is capable of providing that service. One thing that we have recommended and that a lot of people are doing and have done, and several of our instructors in the International Veterinary Dentistry Institute and the Veterinary Dental Practitioner Program use a staging protocol so that they avoid a lot of the things that we run into if we assume that 2 or 3, let's say 2 procedures is all we can do from a perio standpoint on our day tomorrow. So we get those patients in, and lo and behold, one is just a lot of calculus and a lot of cleaning and a little bit of subgingival curettage and root planing, and we're out of there in an hour. The next one is more consistent with what we've talked about, and it takes us 2.5 hours to do that procedure. We've scheduled the whole day for those 2 procedures to last all day, and they haven't. So therein lies a problem. Look at the flip side of that. We schedule 3 procedures per day, and we're, again, at that early level of competency. And each one of those is very difficult, multiple extractions, bad tissue that take us 3 hours each. So therein lies a big problem, because we're already way past the time of the day that the staff is comfortable and you're comfortable being there, and that the owners are comfortable leaving the patients at your practice for that period of time. So the way to avoid that is the way that I alluded to just a second ago, and that is to stage your procedures by getting your patients in, doing a cohat in whatever numbers you're comfortable with, where you do the radiographic assessment, you do the probing and the charting, you clean, and then you wake the patient up And then part of the discharge is going over the treatment plan with the pet parent in order to plan for that next visit, which is 2 weeks to a month away or whatever it might be, so that you actually can do the procedure. And our instructors that do that, our members in our BDP group and our mastermind group that do that, are very comfortable with that, and so are the pet parents. And it gives you an opportunity to do, or your technician an opportunity to do, some really good client education, showing them exactly what's going on, showing them the radiographs and the images you've taken, and really demonstrating the value that you're going to provide when you approach their pet in that 2 to 4 week period or whatever that period might be. So we gain a tremendous benefit there from a planning standpoint. And you may not be able to hit it just right on those first couple of times, but from the first part of that, which is the cohat part, how many of those do you want to do a day? Or maybe you do one a day every day, or however you want to schedule that. And then you have your dentistry 2 or 3 days every 2 or 3 weeks, or maybe you have a dentistry week that you do nothing but dentistry, that you do those procedures and you know what they are before they come in. So you're very comfortable with estimating the amount of time that's going to take in order to perform those procedures on that, however many patients that is. And so that is a really good way to sidestep that original part of the discussion of 2 and maybe 3 patients a day if you are bringing them in and doing the procedure and not knowing what you're getting into. So that's a way of addressing that's been very effective. And I would suggest that you try that and use that, and many of you will be comfortable with that. As a specialist, we get people coming from all over the state, sometimes from all over the country, sometimes from other countries. And so we get our patients in, and we sometimes have some long days, but usually we're out by 4, maybe 5 in the afternoon, sometimes earlier, because we know how many patients to take and how quick we are at getting those patients out of anesthesia and getting them back to the owners, and how quick we are with the procedures. We're not always right, but we're pretty close. So we don't have that luxury, but you do in general practice. So maybe a paradigm shift, maybe something that, well, obviously something that you need to discuss the entire dentistry staff and the powers that be, practice manager, practice owner, and maybe reset the whole approach to looking at your dentistry procedures and looking at your dentistry patients. And guess what else that does? And those days are predictable, and you don't have those patients going overtime beyond what you normally would finish the day at. So your staff is much more comfortable. They're less stressed. They're not trying to hurry through procedures. You have a good estimation about what you need to do to get each one done. And you have the patients that are there that are dropped off in the morning. So all those can be prepared while that first one is being done. So the technical staff can get catheters in, get pre-meds on board, get the tubes ready, everything that needs to be done to make that transition minimal. All of that can be done on that day that you do your procedures after you stage them with your cohaps. So I hope that helps and gives you a perspective that you can draw from and maybe change things in your practice for the better so it's less stressful for everybody in your dentistry service.
I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org. veterinary.org/INV.